Good evening, Nigerians, friends of Nigeria, and viewers from around the world. My name is Kayode Ogundamisi, and this is your station, Ben Television, and your program, Politics with KO. Tonight, we're going to be talking about the state of the healthcare system in Nigeria. How far have we gone? Where are we today? What do we need to improve on? But first, I need to tell you that the National Constitutional Conference, just mark it, conference, is on. I mean, the federal government just released amazing list of eminent Nigerians, you know, who are going to decide your future. They're going to tell us how Nigeria, what Nigeria should look like. They are meant to be representative of the Nigerian people, so they are going to like give us a new constitution, give us the roadmap to how we should live as a people. And the question is, who well, they are eminent Nigerians. Of course, you've got General Ike Nwachukwu, you've got Anthony Aneni's wife, you've got the who is who amongst those who actually put us in the situation that we are in now. So the same set of people that brought us to where we are now are going to go into a conference in Abuja, get 7 million naira per delegate, and then decide our future. Well, good luck to Nigeria. But first, Ngozi, don't let me take the shine out of your news. What do you have for us?
You can never take the shine out of my news card. After all, what you have to say is also news. I don't really have a lot, except that I'm very interested in this Oscar Pistorius' trial in South Africa that's going on at the moment. And new testimony has emerged that he was found crying and praying that God should save his girlfriend's life when she laid it there dying on the night that the event happened, which was Valentine's Day last year. If you remember, he shot his girlfriend. This is the Paralympic star. And he's been tried for her murder now. However, a doctor who's a neighbor of his has now said that he came into the house on the day that this event happened, or on the night rather, and that he heard screams, shoutings after hearing the gunshots. And when he got there, he found Oscar Pistorius leaning over the girl and praying to God to save her life. But the thing is that with what he said now, there's been a bit of conflicting evidence being given. Because if you remember, Oscar said that it was dark when this happened, and so he didn't know it was his girlfriend and he shot her. Whereas what the doctor is saying is that it was light, there was light everywhere. And the other thing he said was that there were screams before he ran into the house, and Oscar was saying, didn't say anything about a scream. So trial carries on Friday, tomorrow, and we'll follow it and see what happens with that. Except I worry a bit about him, though, because of course, as you know, he's a superstar as a Paralympic, and now what happens to him? Anything like this could dent one's reputation, couldn't it? But let's see what happens. Moving on, so the All Progressive Congress Party, the APC in Nigeria, today unveiled its code of ethics.
Okay.
Now, this is to guide the party's activity by showcasing what Nigerians should expect if APC forms a party government in 2015. The state governor, Lagos State Governor Babatunde Fashola, said that the unique thing about this exercise that the APC had undertaken was that APC was making its intention known to the public at a forum other than a campaign rally. Obviously, that's how these things normally are done. So he thinks this is what sets them apart from PDP. And he also says, and I quote, that we in the APC seek to create a new future for Nigeria, a future that Mrs. Kaide's handle, and mine is Gail Ngozi, and tell us what you think. But before I leave that, I have to say that the one thing he said that everybody was a bit skeptical about was he says that members of the APC were united in their belief that corruption must no longer be tolerated in our national life, and that every Nigerian deserves to live in a nation where his basic rights were respected and the rule of law thrives. What do you make of that? Take that quote, tell me what you think. Again, tweet me and let me know. Interesting. For me, one thing I have to say is that it just made it seem like they were actually fighting against one another, because they were talking about PDP not being the best thing. I really don't know.
I would want Governor Fashola to first show a very good example by letting us know how much he's spending in Lagos State. I mean, people have been saying he's doing a wonderful job in Lagos, but the fact is, we actually don't know how much they're spending in Lagos. I mean, people have made FOI information requests for him to tell us how much is going into the coffers of Lagos, and let's also have a transparent statement about the finances in Lagos. So maybe you could start by first letting us know what you're spending in Lagos.
But maybe
when I got there, before you get your card, you have to bribe the,
Also in the UK, so you can give us a very good perspective about both sides.
I'll try my best.
Okay, and the first thing, watching that clip where you got different testimonies from different people saying how they're being treated by the medical system in Nigeria. Why are we in such a state with such, we've got petrodollar, we've got money all over the place. We should be doing better than we're doing now.
I think the first thing I would say is that the healthcare system in Nigeria is in Nigeria. So the healthcare system does not stand alone. It's a reflection of all the problems that we have in Nigeria, either in the judicial sector, the transportation sector, or other sectors. So the healthcare system will be a reflection of what's happening in Nigeria. It doesn't stand alone. So if there are problems in Nigeria generally, there will definitely be problems in the health system specifically. Okay,
now the thing is, it starts from the university where you have to go and train to become either a surgeon, a pharmacologist, or an optometrist. If we saw the state of the educational system with ASU strike, you wonder what kind of medical doctors are we producing? Would you convincingly have confidence in any medical doctor that is produced in Nigeria from maybe 1990 till date? How confident are you?
It's a difficult one. Like I said, it's what's happening either in the training of doctors, in the training of other healthcare professionals. It's an expression of what's happening in any other field.
There are professional rivalries, and dissemination in the healthcare sector. Can you just explain that, medical health workers versus healthcare professionals?
I think basically the rivalry now and lots of the contentious issues are between the doctors and the others, sort of. It's like the doctors versus the other healthcare professionals. And I think there's one thing that is important that we need to know. The Nigerian doctor is a Nigerian. You understand?
That's correct.
So let me try and build it up like this. One of the issues that we have in Nigeria is that we operate a rent system in Nigeria. Do you understand? It's all about oil. We didn't put the oil there, so it's like what we call the national cake issue. So everybody is struggling to get his own share of the national cake. Now, what that does is that it kills innovation, it kills creativity. It kills. So what you now have is a situation where you have the average person wanting to attain status, so he can get to a particular level where he gets the national cake. So the other. What's happened over time is that, this I better pass my neighbor thing, where someone that has status wants to oppress other people. I'm a doctor, but over time, what has happened is that the doctors have actually sort of not looked after the other healthcare professionals.
Before you continue, I'm going to have a call. I've got a caller on the line. Hello, good evening.
How are you?
Hello, good evening.
Good evening, Kayode. How are you?
I'm fine, thank you. What's your name and where are you calling from, please?
My name is Yinka, and I'm calling from Preston.
All right, go ahead, Yinka.
Thank you very much. I am so much keen about this topic you're bringing up today, which is about health. You see, I'll be telling you the facts behind all these ulabaloo and the national attitude that we are putting into our health sector. You see, like your guest said about saying that everything was about the fault in Nigeria and it will affect everything. But let me tell you, all started when these politicians came into power. What they are now saying is structural. Like roads, like ambulance and others, like you said. You see, Nigeria is, I don't know, you can't just compare Nigeria health system with United Kingdom health system. It's quite opposite, And I believe that if you start talking from now till the kingdom comes, there won't be any change. Unless we get all these politicians kicked out in the country, that's when we can get things solved.
Sam, let me just let me bring in Douglas in here. We've got medical tourism by Nigerians to India, Europe, Middle East, and it's not just the upper class that's doing it. It's like almost everyone now. We even now go to Ghana, Cameroon. Can you just enlighten us about medical tourism?
I think it's a big fish of massive capital flight. In the Vanguard publication of 13th of October 2013, Dr. What's his name? Dr. Kingsley Segwe, he was one of the chaps who was organizing the Nigerian Centenary Ball recently. Yes. He said that Nigeria has about 250 billion naira going out of Nigeria to India and other countries. And then the Dr. Enabulele, Osaon Abulele, who is the NMA president, the Nigerian Medical Association president, quoted in the same paper in September 2013, he stated a figure of about 125 billion. So
that's
this
a huge
massive
amount.
Capital flight. And then the key issue here with medical tourism is that the kind of treatments that people are going for, they are not going for treatments like for malaria, typhoid, HIV, tuberculosis, respiratory infections, the kind of things that you see where the donor agencies donate stuff for. They are going for things like neurosurgery, spinal surgery, kidney transplants, and all those kind of things. So I think it's massive capital flight. It's the kind of money that if we had those kind of services on ground, you have a value chain.
But what does it take to have those kind of services in our country?
I think one of the key things we need to do is look at the Indian model. What happened historically is that the Indians came out of their country, that's the healthcare professionals, the doctors and the others, went to places like America, the UK, Australia, and then they got trained at the level, to that massive level, very skilled. And then a few of them went back to their country, and the government in India actually facilitated loans and the rest of them for them to build up these top centers. You know, and now people come all the way from the world, from all over the world to get these services. And it's massive inflow of capital.
Well, you know what I find amazing? I was told that if Nigerian healthcare workers pull out of the NHS in the UK and pull out of the medical system in America, that there's going to be a big gap.
Definitely.
You know? So,
definitely, Coyote.
So we have Nigerian doctors and healthcare professionals in the UK and in diaspora. Do you guys have anywhere you meet that you just have an association to look at things at home?
Now, the GMC, or the General Medical Council, is the body that regulates doctors here. And in a publication by the GMC in 2011, it stated very clearly that Nigerian doctors with primary medical qualification from Nigeria, i.e. people like me, I finished from University of Benin, were up to about 3,500.
Wow. In the UK?
In the UK, 3,500, right? Now, if you add the Nigerian doctors who actually train in the Europe or in the UK, you're turning up to about 5,000. You know, and they were ranked in terms of population about on the 5th or so. So that's a significant contribution to a system like the UK.
And compared to Nigerian medical doctors in Nigeria, that's a huge...
Definitely a massive percentage of the number of doctors that were trained in Nigeria. We definitely do meet. We have a body called the Medical Association of Nigerians across Great Britain, shortly MANSAG. And what MANSAG, what's its key role is basically to facilitate.
Are you still there? Good evening. Okay, I think we probably lost. Hello?
Hello?
Yeah, good evening. What's your name?
Hello, good evening.
Where are you calling from?
Hello?
Hello, go ahead, please.
Hello, good evening.
Yes.
They know how things work, and we expect them to even take all these things back home. We are looking at doctors going back to render services to people in Nigeria. It's not enough. When these people go to Nigeria, they will still come back here. What is our government doing, even to encourage?
Time has gone. Probably we should be discussing how do we sort these issues out.
Yeah.
But
okay, before we get to that, let me take this caller, Sheyi, and then Sheyi, good evening. Hello, Sheyi, good evening.
Hello?
Hello, Sheyi, go ahead, please. Where are you calling from?
Hello?
Hello, I can hear you.
Hello?
Hello, Sheyi, go ahead, I can hear you.
Hello?
Okay, I think we're having problems.
Hello?
Hello, Sheyi, you need to speak. Go ahead and talk.
Hello?
Okay, we will just go straight now. We've looked at all the problems, we're having, and we know we've got a very huge problem. Yeah. What are the solutions?
I think, first of all, what I would say about solutions is that it's multi-pronged. It's not just going to be one thing. Yeah. And first of all, we need to understand, get a grasp of what the true reality is on ground. Yeah. most of the time people say, oh, the government needs to do that. And the question I ask is, which government are we talking about? Is it the same one we're talking about in Nigeria? Yeah. So we need to start thinking laterally. There are different issues. First of all, we need to try and push for to have round pegs in round holes. Oh, yeah. I'll give you an example. The present Minister of Health is a square in a round hole.
Why did you say that?
Because he does not have the capacity, to deliver on and move the healthcare forward in Nigeria. Remember, in 2012, when we organized the Mansag meeting, he came to give a talk, and it was an opportunity for Professor Chukwu to discuss what the issues were and to try and show the potentials in the Nigerian healthcare system. Remember, he was talking to Nigerian doctors and other healthcare professionals. But do you know what happened? He was given 45 minutes to do that, and it took about 1 hour, 30 minutes, saying all sorts of things I don't understand. You understand? So, and it wasn't
so we have a minister who has no understanding.
He doesn't have a clue. Do you understand? He doesn't have a clue at all.
But one would expect that people in your position, like your when I say your position, I mean doctors in diaspora, will be hitting at the presidency and saying you need to do something like
that. Well, I think...
Or relate to the Nigerian Medical Association.
Oh, no, yeah, definitely, because I remember, I personally, then when we did that meeting, I was the one that made sure that Dr. Enabulele, the NME president, came into the UK to that meeting so we can start that relationship between Mansag, Association of Nigerian Doctors in the UK, and NMA, Association of Nigerian Doctors in Nigeria. So yeah, moving forward, it's going to be a process, but I think we will get there. There's a new generation of Nigerian doctors, healthcare professionals who are passionate, about moving things forward in Nigeria. And like I said, the diaspora is going to play a key role.
But, I know we've been talking about the healthcare system, but when I go home, I make it a point of duty to go to Ikare, which is my village. And one of the things I see is World Health Organization donating fantastic buildings for primary health care. And all you just have is a single bed, a single chair, and a computer. I mean, is it misplaced priority? Because my understanding is that primary health care is where you stop or prevent the...
I think the issues that you stole the words out of my mouth, priorities. You understand? The problem is Nigerians should understand that if Nigeria is going to move forward, it's going to be moved forward by Nigerians. If you go to lots of meetings, scientific meetings, conferences where they talk about healthcare, you find that all they talk about is tuberculosis, HIV. And why do they talk about these things? Because that is what the donor agencies support. That's where the money of the donor agencies support. But there are other key issues. There's the issue of non-communicable disease, cancers, hypertension, diabetes. Those things are killers in Nigeria. Acute services, emergency care, trauma. You can see the Boko Haram now with all the trauma, accidents and stuff like that. Those are key public health issues.
We're not prepared for
we are not pushing for policies regarding those issues because, well, the international community is not doing that. But we need to look deep in ourselves.
Let's see what Omo has got to say. Omo, good evening.
Hello, good evening.
Where are you calling from, please?
I'm calling from London.
All right, go ahead, please.
Good evening, Mr. Oko. It's Omo on the line.
Good evening, Omo.
Actually, I'm really happy about this discussion you're having on the phone on this politics right now. My question is, how do we move from where we are now forward? Because we know that the sector is really appalling. At least I know a lot about UBTH. Like I was born there, I've been there for a lot of services. You know, looking back, much that have gone bad in terms of no maintenance culture, the attitude of healthcare professionals and the health givers is really bad. So how do we go ahead? How do we move from where we are now to?
Okay, thanks so much.
Going forward, how do we make these things right?
Well,
how do we act at it?
All right. Before you answer, Omo, I've got Dr. Adebola Ojoye from Sheffield, and he's saying, "Thank you for bringing Douglas on the show. I am quite keen about the healthcare system. How can we strengthen and infuse interdisciplinary research approaches into our healthcare system?" If you could answer that with Omo's question.
Yeah, I think basically let's just take a few things. Number one, I think what we need to do is to empower Nigerians generally with information. Do you understand? Because what's happening in Nigeria is that we are operating at a very low level, and we need to actually take that level higher. So that's what we call health promotion and advocacy. You understand? The Nigerians need to know about these things, what the health issues are and stuff, where to go to and stuff. It's easy to go on the net and find a neurosurgeon in the UK or in America than to find a neurosurgeon in Nigeria when you're in Nigeria.
Seriously?
Yeah, exactly. Do you understand? So health promotion, improving the perception. So that's one key thing. Investment, very, 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 very important. And I think I must say thank you to people like Dangote, Jimovia, and the rest of them who have just established the private sector health alliance for Nigeria, which the executive director is a chap called Dr. Muntaka Umar Sadiq, who actually trained here in the UK and did an MBA in Cambridge. So I think it's key. Investment is key. And the private people definitely need to come in. I know some people might say, oh, is the environment ripe enough for the investment? But yeah, we need to start from somewhere.
Just the way we're investing in telecommunications and...
Hello?
Hello, Bumi, where are you calling from, please?
Hello?
Hello, good evening.
Hello?
I can hear you. Just go ahead, please.
Hello?
Okay, Bumi, for the last...
Hello?
I can hear you.
Oh, good evening.
Good evening.
Good evening, Kaidi.
Yeah, good evening.
I remember Nigeria when you did have a very good health service.
Okay.
I've been married to a Nigerian for 54 years. But I would never have risked my own health. Whenever we go there, my husband always used to say, if I'm ill, get me out of the country on the first plane possible.
Wow.
It isn't that. It's just this attitude that they have. Most of the doctors I knew trained here. A lot of my relatives, my in-laws actually, are here. They have done the BAP. They've done, and they're working very well here. They don't want to go back because it's so, I don't know. Nobody seems to bother. In 1980, I had the chance to go and look round Luth Hospital in Lagos. And I couldn't believe it. I really could not believe the state of the hospital in 1980.
Thanks so much.
It needed a damn good scrub.
I think from what Bumi has raised, I think there's something key that need to make everybody understand.
And that was Luth she's describing in 1980.
Yeah, like I said, we said before, things have actually deteriorated over time. But it's important that we all understand something here, right? Whatever happens in Nigeria affects all of us, whether we want to go back to Nigeria, whether we're in America or whatever. And I keep telling people that every doctor, every nurse that is outside Nigeria, in the UK or whatever, cannot go back to Nigeria. But some people do have to go to beef up things and help in Nigeria. It's about looking at the bigger picture of things and understanding the bigger picture of things. So it's really important that even though as a doctor or a nurse in the UK or America, and you don't want to go back to Nigeria, you should be interested and contribute your own quota somehow, some way to what's happening in Nigeria.
I've got Emeka here. Emeka says, talking about high blood pressure, are there research centers in Nigeria that need assistance from the public, i.e. being volunteers for research, making regular financial contribution? I think this is someone who wants to actually do something, but we just need to be quick about it.
I think like Bola was asking about research and stuff like that. Research and development is key in any sector, including the healthcare system as well. So yeah, I think it's something that's quite important.
All right, Douglas, it's good to have you on the program. Thank you for coming.
It was nice having me.
Viewers, we've run out of time. Good night. We'll see you next Thursday when we bring another topical issue on politics with KO. God bless you. It's your program, Politics with KO, 9 p.m. to 10 p.m. Thursdays.